Hey y'all, it is Nurse Kia, Unorthodox Nurse, and today I'm here to do a video about fibroids because one of my good friends, she went to see one, and I thought that was a great idea because many Black women unfortunately suffer from fibroids. So what is a fibroid? Fibroids are also known as leiomyomas, and it is a non-cancerous growth that develops from the muscle tissue in the uterus. Very rarely will it cause cancer or increase your chances of getting cancer. A woman can have one or several fibroids at the same time, and they also can grow at different speeds. I did my research, and it seems like they really don't know why people get fibroids, but they have seen that some of the risk factors have been obesity, a family history of having fibroids, increased estrogen, and race, an increase of intake of red meats, alcohol, early onset of puberty, so someone who may get their period early. So fibroids, they normally occur during childbearing ages, but generally women between 30 and 40 experience fibroids the most. And some symptoms that a woman may have, like increased pelvic pain, really heavy menstrual bleeding, fever, pelvic pressure, constipation. You may pee a lot, like sharp acute pain in the abdomen area, and decrease in blood count because you're losing so much blood from the heavy menstrual bleeding. And some tests that doctors will do a sonogram. They also can do an MRI if they want to get some further studies. They can do a CBC, which is a complete blood count. Also, a test called hysteroscopy can be done. That is basically a doctor will insert saline in a woman's uterus, and then they'll use a light to examine, to see like a little telescope to see if a woman has fibroids in that area. So one medication suggested is an IUD. So basically IUDs, or some IUDs will release a progesterone hormone, and that hormone will help with the pain and help with the cramps. Another medication is gonadotropin. So gonadotropin is antagonist. Basically, it like tricks your mind into thinking that you're going through menopause. So with your mind thinking you're going through menopause, those fibroids, they won't go away, but they will shrink. And with them shrinking, less pain, less blood, like that. Another medication that can be given is NSAIDs, which is basically a non-inflammatory med. Those are your over-the-counter medications such as like Advil, Motrin. Those are things that can help with cramps. Also, you can take tranexamic acid. That is medication that you take while you're bleeding. It's supposed to decrease and help with that bleeding. So those are some options that a woman may have. Okay, lastly, I want to talk about surgical interventions that can be done for fibroids. So, of course, a woman can have a hysterectomy, but if you have a hysterectomy, you're not able to have children because it's literally going to remove your entire uterus. Also, a myectomy is when they remove the fibroids, but they will keep the healthy tissue around the fibroid. It's fibroid uterine embolization. So that's basically, it's a minor procedure. That is when the doctor will go in and cut off the blood supply to that particular fibroid. Yeah, so this is pretty much fibroids in a whole, and I hope you guys found it informative. Fibroids. I know women who suffer from fibroids, it can be very difficult, very challenging. So my heart goes out to all of the women who suffer from fibroids. And again, thank you very much for watching my video, and follow me on Instagram, unorthodox_nurse, and always let me know some suggestions, some feedbacks. I appreciate it greatly. Thank you.